Hi, I'm Viv and I'm the face behind Skin Farmer Aesthetics in Stockton-on-Tees, and I thought I'd do a live this evening, and I'm very proud and happy to be joined hopefully by Taimur Shoaib, who's a consultant plastic surgeon based in Glasgow up in Scotland. So I'll just see where Taimur is, he shouldn't be too long. It should be an interesting chat with him because he's involved with facial aesthetic work, but he carries out surgical work too, and his background is plastic surgery, so he should be able to give us quite a good chat about the work that he does. So I'll just see where he is. It won't be a second. There we go, I've just sent him an invite, hopefully it won't be too long. Yeah, it's somebody I've come across because of another person. Ah, there you are, Taimur, I think you're trying to join. Won't be a sec. There you go, I've just sent you an invite, Taimur. You should be able to just accept that invite, hopefully. Ah, here he is. Right, let's see. Should be joining me now, Taimur. I think your camera's on the other way, Taimur.
I think it is.
It is,
Uh,
yeah.
all right, let's see if I can work out how to change that camera.
Should be just a little reverse button at the bottom of your screen somewhere.
Yeah, that's what they all say. Yeah, I know.
You've got it.
Right, let's see what I can do. Oh no, maybe I should. Oh, dearie me, how am I going to do this?
Don't worry. It's usually at the bottom of the screen, a little camera. There you are. Nice
Dearie
to
me.
nice to see you at last. It's nice to actually see you face to face, even though it's online. But how are you doing? Have you had a good day today?
Yeah, I was operating in the morning, and then I had a bit of a break in the afternoon, so I just had to catch up with a few things. And you'll
Yeah,
have to
yeah.
excuse the mess in the background. I'm having some work done in my house, and it's just
Oh, it's been
it's good. And I'll take my
difficult,
glasses
is
off
it?
because you can see the reflection
Oh,
of the light
it's
that
no
I've got.
problem. You look fine either way, don't worry. But thanks a lot for
Well,
joining me
I've got
today.
a permanent beauty filter on in my camera, so
Have you really?
I think so.
I,
You should
I
see
wouldn't
me
have
in
thought
real
you.
life.
I wouldn't have thought you'd have needed that of all people. I wouldn't have thought you would. But thanks a lot for joining me tonight. I've got to thank Balsam, actually, Balsam Alabasi from Derm Refined Skin Clinic in Mayfair. She very kindly introduced us to each other. I'd never really come across you. I've heard of you, but I've never really found out much information about your background. So it was interesting to speak to her about you, and she passed on my details to you as well. So it's really a chat I wanted to have with you about your work, Taimur, to see what you do and how you've got into it and what your plans are as well for the future. So I hope you don't mind me asking you a few different questions about that.
Far away.
Okay, right. So, your background, how would you describe the sorts of work you do? Most of the people that are watching this are probably members of the public. There's probably quite a few practitioners, non-surgical practitioners, maybe the odd plastic surgeon, not very many, but for them to understand as easily as possible, how would you describe your work overall? How would you describe that to them?
Well, I would call myself a consultant plastic surgeon, and my work nowadays is solely in aesthetic surgery. Well, aesthetic surgery and aesthetic medicine. And the vast majority of my work, I would say, is surgical, and probably about 10% of my work is in fillers and Botox. and that's my
Yeah.
clinical work. I
Yeah.
also have a bit of a medico-legal practice, and I have a few teaching commitments as well. So
Right.
that's probably a summary of what I do.
So you do quite a broad range of work. It's not a single type of work that you do. You're quite varied in the work that you're carrying out day to day, I think, based on what you've said. And
Yeah, and you know, even in aesthetic surgery, you know, there are
yeah,
some surgeons who will just concentrate on the face. There are
yeah,
some who will just concentrate on body work.
yeah,
And I suppose my background, you know, every plastic surgeon is trained in body work, and we do that throughout our training, and we follow it up in our careers as well. And
yeah,
some of us are trained in head and neck work. So when I was appointed as a consultant in the NHS,
yeah,
my job was to perform cancers of the face and mouth. So from around here to
yeah,
about there. And you know, above that is the neurosurgeons, and below that is the ENT surgeons. So it was that kind of
yeah.
area here. And you know, when I started as a plastic surgeon, that was about 15 years ago, something like that.
Yeah,
And you know, that was before we had Instagram and Facebook, and you know, I suppose people would still want cosmetic consultations. And so I
yeah,
guess back in the day, people would go to their GP and would say, "Doctor, who do you think I should go to get my my work done?" And
yeah,
and maybe the GPs would say, "Well, why don't you go see this joker that I know called this Shoaib fellow?" And you know, he does a bit of head and neck work, and he does a bit of body work. And then also, you know, people would come and I would do their eyes, their nose, their face, and they would say, "Well, can you do my Botox and can you do my fillers now?" And again, it was before the days where we could just do our online research and find someone.
yeah,
So
yeah,
so I started doing a few fillers and Botoxes, and you know, my clinics became jam-packed full of people getting follow-ups
yeah.
for these treatments. And so I had to ask the private hospitals, you know, can I get more space? And eventually they said, well, we don't have any more space on the days when you're free. So I said, well, maybe I'll just set up my own clinic. So that happened about 3 years after I was appointed as a consultant.
Yeah, yeah. You've done a lot in the time you've been doing this work. I think it's amazing to hear someone like you talk about the different things that you do. So for somebody that perhaps doesn't know about the path that practitioners would follow, say from doing your O levels, doing your A levels, and then getting into medical school, how did you progress from that point, from starting off, you know, at the beginning of medical school? So you did your O levels years back, just like me, I'm guessing. You did your A levels. You got you got the qualifications you needed to get into medical school. So what happened once you started medical school, Taimur?
Well, you know, it's funny because linked up and hooked up with one of my lab partners at university, and on Facebook, and she said, "Oh, you're a plastic surgeon. You always said you wanted to be one." And she was my lab partner for first year and second year, so I must have said at that time because I don't remember saying it, but obviously she did. And so, and towards the end of medical school, I remember doing a surgical attachment, and the consultant who was looking after us, he said, "Look, is there anything you haven't seen that you'd like to see?" And I said, well, I haven't seen any plastic surgery. So we spent a day at the local plastic surgery hospital. And then I got a junior doctor's post at that same hospital later on. And I thought, this is really interesting. This is quite intricate surgery. And I said to myself, you know, I'd like to be a hand surgeon because I think hand surgery is quite intricate. It's quite delicate. You know, the hand is a work of art. And all the way all the tendons interdigitate with one another and the muscles that are there. So I thought I'd like to be a hand surgeon. So then I got another job at Oxford, and I saw some head and neck surgery. Then I thought, well, this is interesting, and I saw some skin cancer work, and I thought, well, that's quite interesting as well. And I thought this is difficult surgery, and I thought this will take me a long time to you know, to develop my skills in it. And even as a consultant, I think it's difficult surgery. So I
Yeah.
thought, so I then pathed my career to try and become a head and neck plastic surgeon. So that's what I did.
Amazing, amazing. It's a great work you do for the people that you carry out the work for. Um, what would you say? Well, I've got a few questions. One of the questions I wanted to ask you actually, plastic surgery. For somebody that doesn't understand why it's termed plastic surgery, why is that? Why is the work you call plastic surgery, Taimur?
I think there's a Greek origin to the word, and plastikos meaning it means to mold or to shape. And so a
Right.
lot of what we do is reconstructive work, and we reshape and we remodel, and we I suppose where our job is to build things back up and perform reconstructive work, and so that's the basis of that. But I guess nowadays we're sticking plastic in people as well. So
Yeah, yeah. It's just in case people wondered, are you actually, when you first started off, there wasn't any particular plastic material that was involved in the work directly. It's more a case now because of non-surgical work and surgical work together. Um, you do a lot of different types of work. What would you say you enjoy about it most? What really drives you to do the work?
you know, it's nice. I'm in a nice position because if there's anything that I don't enjoy, I just won't do it. But the hardest thing about career development, I think, in plastic surgery and in aesthetic surgery, aesthetic medicine, is you got to give up things. And so in my training, I was doing limb reconstructions and breast reconstructions and head and neck surgery, skin cancer work. I was part of we train in cleft lip and palate surgery and burn surgery. You have to give all these things up. And when you become a consultant, of course, you have a general interest in plastic surgery, but we all subspecialize. And so my subspecialty interests were head and neck surgery and skin cancer surgery, particularly the skin cancers that had spread. And of course, I started my private practice shortly after that, mainly in aesthetic medicine and surgery. And then, I went part-time in the NHS and I had to start giving up some of the things there. So I gave up my head and neck surgery work. I was just doing skin cancers that had started to spread.
Yeah.
And then I left the NHS, so I had to give up my reconstructive work. And it's hard, to give up things that you really enjoy. So
Yeah. Yeah.
you got to do what you got to do. And they say as you get more and more older and more mature in your career, you get to know more and more about less and less. And the obvious the obvious endpoint to that is that eventually you'll know everything about nothing.
Yeah. There's a lot of people that know everything about nothing, I think. There's quite a few of them around. So you've got your own private clinic called Belle Forme in Glasgow, and you've got other practitioners who work for you in specialists. Do you get on well with them, with the other practitioners at the clinic?
Yeah, I don't know if they would say the same about me. I mean, but I think they do. The reason someone is appointed is because competency is a given. Everyone's got to be good at what they do if we want to take them on as our friends, our colleagues, our associates, our partners. But I think that some people have got really nice personalities and they shine and they really bring a bit of sunshine into our lives and that's reflected onto how they manage the patients and so these are the people that I want working with me, and it just means that the whole team has a very pleasant experience whenever we're working together, no matter who it is that's working with us. And I know one or two of my colleagues are here on the live. I've seen them join in, and I really do very much like working with the people that I work with.
Yeah. No, no, your enthusiasm certainly shows through. I think it's going to be hard keeping to a time limit tonight because we're both going to be talking so much about the work we do. Do you have any funny stories about any of the work that you've done in the past, Taimur?
Yeah, when I was a very junior doctor, I wanted to I wanted to go into plastic surgery as a career, and so for a while, I thought I had the opportunity of carrying on in one of my jobs, but I gave that job up, and I just I had a gap of about 3 months, And so I had done a bit of laser work back in 1994 when I was a very junior doctor in plastic surgery, and so I started working in a clinic where the job that I did was laser tattoo removal. So there were a few tattoos there, and there was one man who had the map of Italy on his back, but the boot was pointing the wrong way. So he said, "I've got to get this removed." We had there was some guy called Gary, and he had Gary with it was printed on his knuckles, but he got an injury on the R, and so that part of his hand was taken off, and so he just said Gay. So he was quite a hard nut, so he wanted that removed. So I think sometimes we see some funny tattoos. I think that's probably the funniest aspect of what we see. And of course, if you engage with your patients, you can have a bit of a laugh with them, but maybe that's not for everyone.
Yeah, it's certainly interesting speaking to different people all the time. You hear different stories all the time about what they get up to and the reasons they've come to see you in the first place. We could talk about tattoo removal all on its own, but we'll carry on and we'll go through the rest of the chat anyway. So you do different types of work. So in terms of the actual treatments that you carry out, Taimur, surgical and non-surgical, what particular treatments are you known well for? What's the work you specialize in particular?
It'd be hard to pinpoint one particular thing that I do. So I enjoy everything that I do. So I think my two most common surgical procedures are rhinoplasties and all types of breast surgery. And in terms of non-surgical work, fillers and lasers, I think what I do most is probably non-surgical facelifts, where we're using multiple syringes, 4, 8, 12, 16 syringes of filler, and also a carbon dioxide laser resurfacing. So these are I suppose those are the four most common things that I do and that I enjoy. And you see a big difference, and you make big differences to people's lives. The people that come to see me on whom I do a rhinoplasty, it's affected them for 10 years, and they say, I've been thinking about having something for 10 years. I was teased during my teenage years. I was bullied at school, and it really causes me a bit of distress. And I just want to normalize my appearance. I just want to close that book in the chapter of my life, and I just want to move on and just do things. I just want to function in society normally. And people tell me their stories about how their appearance has affected them, and then when we change that, I ask my patients, so how has it made a difference to your life? And they tell me some really nice things. There was one person who said, I was sitting in the train, and the sun was beating down from behind me, and I saw my shadow on the train. And I saw this beautifully straight nose, and I just couldn't stop looking at my shadow. And I thought, well, that's quite nice. That's quite funny.
It's a nice it's great to have great compliments from your patients over a period of time. It really makes it worthwhile when they tell you what they think of your work. Do you have a favourite treatment of all that you prefer doing, or that gives you the most pleasure in doing?
I think it's hard for me. It's going to be hard for me to pin one particular treatment down, but I like to make differences to people's lives, and obviously in a positive way. And I like to hear people's stories. I like to hear, how is this affecting you? And, why are we doing this? Why should we be doing any kind of treatment? And I always ask them afterwards, how has it made a difference? And I think the biggest differences are in people's facial appearances.
Yeah. It's just, I've been doing aesthetic work, non-surgical work, for about 5 years now. My background is clinical pharmacy. I'm a pharmacist prescriber. And I posted a few days back about a lady I treated about 4 years ago, just for marionette lines. It's just a simple problem of a marionette lines from the mouth down towards the jawline. and it gave her a permanently sad look. No matter what she did, she looked sad. And she came to me, she was scared of needles. I managed to do the work, and it took 2 steps to get to the point that she wanted to reach. And she keeps coming back to me now after these every year for the last 4 years. And she's still so happy about the work I did and the fact that she found me in the first place. And it's really gratifying, you know, to be able to speak to somebody like that whose life you've changed massively in their opinion. So you do that every single day in multiple ways. So I think it's amazing to be able to talk to you about that. So thanks for that. What's your view of non-surgical cosmetic treatments, Taimur, such as fillers? The reason I'm asking particularly is because, as I say, I'm a non-surgical practitioner. I don't do any surgical work. I'm not a doctor, I'm a pharmacist. Most of the practitioners in the UK are all carry out non-surgical work in terms of filler usage. You do surgical and non-surgical, and you've got a good idea of what to use for certain patients and when to move from maybe non-surgical to surgical work, which is beyond the scope of most non-surgical practitioners. They stick to use of fillers, they stick to use of peels, Botox, etc. But the point at which they'd move a patient possibly from non-surgical work to surgical treatment is difficult for them because they don't always understand what can be done surgically. What's your view of the use of non-surgical treatment in patients that you treat?
I think they go hand in hand and they're not mutually exclusive, but equally, when someone has a surgical procedure to reshape their face, I think we have to maintain that. And I often think about it in terms of, you know, you buy a nice car and you gotta service it every year. And if you don't service it, you don't have to service it, but eventually, you know, the oil's going to get a bit sludgy, it's going to choke up your engine, and you're going to have to buy a new car. So if someone has a facelift, you know, they should have a few fillers from time to time. They should have some lasers, some Botox, and you know, maybe they should do that once every 6 months, once every 12 months, and that's just it's just their annual MOT, it's just their annual service, isn't it? So that's one way of looking at it. Another way is that sometimes I'll do something surgical, but I will say that as part of your treatment plan, you'll definitely need some non-surgical treatments performed at the same time. And there was a time, for example, I saw a man, and he said, "Do you know, I exercise all the time. I keep myself really fit. I had a rhinoplasty, you know, many years ago, but you know, now I'm in my middle age. You know, my face is getting a little bit a trim just because you know, he was exercising so much and he was keeping himself so fit. But I think my nose feels a little bit too big now for my face. You know, I'd like to have it made smaller." And I said, "Look, you're right." I said, "You know, your nose is disproportionately large to your face, but your face is disproportionately small to your nose." So I actually did 2 treatments on him. I did I did a rhinoplasty to make his nose smaller, but I also gave him, I think, about 10 or 12 syringes of filler while he was having his operation for his nose, just to add a little bit of width and definition and contours to the rest of his face as well. So I think they work well together, just to balance things out, and I think also non-surgical treatments, they're much more precise, and you can fine tune a lot of things. Whereas surgery, it's the bigger picture. It's a blunderbuss approach, and it's you know, we make a face tighter. We lift a face with a lift. We make a nose smaller all around. But with the imperfections that we always see with the surgical procedure, fillers can fine tune the results, I think, as well.
Yeah. No, it's nice to be able to hear someone like you speak, not just about surgical work, but non-surgical as well, and how both can integrate well with each other. What are the main issues you tend to see concerning patient requests for treatment, surgical treatment in particular? What are the main issues that are involved for you?
Well, I think there's always got to be a why. You know, why are we doing this? It's always going to have an impact on their lives. And I remember seeing one person who came to me saying, I'd like to have a rhinoplasty. And I said, well, how does it affect you? And she said, well, it doesn't really affect me. I said, well, why are we doing this then? She said, well, I don't know. You know, I just want a smaller nose. And I said, well, you know, there's a lot of risks associated with a procedure like that. Maybe we shouldn't be doing it. So I think that's important. You know, why are we doing something?
Yeah, yeah. It's just that there's so many different issues that patients face now, and I think a lot of problems I didn't even think existed. You know, there's like treatments available for a problem that never existed, and I just find it odd. Like I don't know what you think of it, but with Botox for calf muscles, like to me, why do you need it? You know, but there's practitioners around the country that do Botox to reduce the size of calf muscles in the legs. What do you think of that?
We're never happy, are we? We want bigger calves, we want smaller calves, we want a bigger nose, we want a smaller nose, we want a bigger face, we want a smaller face. When breasts, we want them higher, the lower, you know, bigger and smaller. We're just never happy, are we? So, and for you and me.
Yeah. What about like a woman that might come to you for, say, breast augmentation? How do you deal with the whole picture of somebody thinking about it, coming to you, expecting you to treat them? How does the pathway work when somebody first thinks they want some surgery? Call it, say, breast augmentation. What would happen and what would go through your mind when there's a request for something like breast augmentation?
I think there are two reasons why people will want to have breast augmentation surgery. One of which is, do you know, I've never really had anything and I just want to have a degree of femininity. And, you know, I've always felt a bit small. I've always felt a bit embarrassed. You know, if I go to the beach, if I go on holiday, you know, when I'm in intimate situations, I don't really feel as womanly as I really would like to feel because I've never really developed. And I've seen my friends develop and I've seen other people have a big difference to their lives by having surgery. And so I'd come to speak to you about this. So that's one reason. And I think the other is people say, you know, I used to be quite nice. I used to be very happy with my body, but things have changed. You know, some people may have had a bit of weight loss. Some people may have had a few children, and you know, we love our children, but they have an impact on a woman's body, don't they? And so they say my family is now complete, or I've reached my target weight. And often they'll say, you know, I was never really completely happy with my appearance. And now now I'm ready to go ahead and have something done. So I think these are the two main reasons why people come to see me. And a lot of people are just looking for normalization. They just want to feel normal. They want to feel happy, and they want to function in society in the circle in which they function to as great a degree as they want. I don't think people come in saying, you know, I want a specific look. I want to have, you know, big round fake breasts. It's just not the vast majority of requests, and the majority of people they have these stories, and this is why people come for breast augmentation.
Yeah, yeah. Do you have any odd requests in terms of appearance, surgical or non-surgical? There must be a slightly odd request, or request that you think, well, why do they really want that? Is there anything like that that's happened before with you?
Yeah, and I usually, you know, I usually filter them out at the inquiry stage. And you know, I had a man, and he was from France. He said, "I am a man in France," and he said, my girlfriend is undergoing breast augmentation surgery, and I would like to follow her in her journey. So, could you do the same for me?" So I said no. I said I don't have any experience of this. So,
Yeah, yeah, right, okay.
so,
Absolutely
so
not come across anything like that before.
no, I think that was probably the most unusual request that I've had. But I actually went to a conference once, and it was a conference of the, you know, of one of the British plastic surgery societies, and there was a talk from a Dutch plastic surgeon, and the talk was entitled my unusual plastic surgery procedures that I've performed in the past. And he said one of the most unusual was there was a man who wanted to be dragged around the room by his dominatrix. And he wanted a handle booked into his, he wanted a handle made into his abdomen so that he could be dragged around.
Okay, all right. I'm guessing you didn't do the work.
No, this Dutch plastic surgeon did the work.
Oh,
But
right, sorry.
yeah, so it was his presentation entitled "My Unusual Plastic Surgery
Right.
Procedures."
Okay.
Yeah, so I suppose I suppose you get your extremes, and
Yeah,
I'm not really an extreme kind of guy. I think I think the vast majority of plastic surgeons and the vast majority of people who come and see us, it's really just for normalization. And
yeah, yeah,
it's just for, I want to look a little bit better and I want to normalize my appearance. You know, they say there are four types of people that come and see us. There's the normalization, beautification, aging gracefully, and transformation. And,
yeah,
you know, among those, among that group of people, the transformation group is something that we tend not to see. You know, they want their whole face shape changed, and they may be from a part of the world where they have specific facial features which are specific to their cultural backgrounds, and they want to change it around quite considerably. And you know, I don't really do that work. We have the aging gracefully group of people who say, you know, I look in the mirror, and when I look in the mirror, I don't see on the outside what I feel on the inside. And I feel full of life, full of vitality, full of joie de vivre, and I just don't see that when I look in the mirror. So the change that we want to make is to make them age gracefully and to carry on looking pretty much the same as the years go by. There's the beautification market. You know, I want to look good in my selfies. You know, I take a selfie every day. I wear a new outfit every day, and you know, I want to have my lips done, my eyelashes, my nails, I put my fake tan on, and you know, it's you know, it's one of these things that a lot of people will want. I'm just reading the comments there. One of my friends wants to handle. I'll sort you out, Tommy. No problem. Anytime you want.
I've got to apologise to the viewers. I've not been reading the comments. I've been listening to you most of the time, Taimur, so apologies for that. So yeah, looking at, again, the treatments that you do. I do work with lip augmentation in particular, non-surgical dermal filler-based treatments. And I see patients with scarring, in particular scarring around the lip area. And I carry out a number of different treatments to try and ease the problem. There's lots of different things that might have caused the issue. There's also issues like cleft palate. There's patients that you deal with in terms of cleft palate treatment. In terms of the scarring, how do you deal with that in terms of surgical work and minimizing scarring or treating scarring? If it's already occurred through previous surgery or through injury, what's your view of treatment with scarring as the main problem?
Well, I think there's two types of scars. There's scars on the outside and there's scars on the inside. Because if you do any work, then there's going to be a lot of scarring on the inside. Sometimes you have to address that. And then there's scarring on the outside. You know, people have scars on their skin. And you know, when we look at a skin scar, I think we just got to examine it because the examination findings direct the treatments. So sometimes a scar is red, and if it's red, then we can laser it to make it less red because the lasers will seal off the blood vessels. If the scar is raised and itchy, then we can put steroids in it, and that'll flatten it down and make it less itchy. The scar may be stretched, and so sometimes you can cut it out and stitch it back together again. The scar may cross the lines of election. You know, the thing is, when you smile, you know, we see lines like this. When we frown, we see lines across the way. When you raise our eyebrows, we see lines across the way. Sometimes the scar is at right angles to these lines, and so we can alter the orientation of the scar just to make it hidden a bit more and to make it more in the lines of our wrinkle lines. So it depends what a scar looks like on the outside. Sometimes the scar is indented, so we can put some fillers in and outdent it, or put some fat grafts in them. Sometimes we can take a graft of dermis, and we can bury that into the scar as well if it's a bit indented. So there's all sorts of appearances that we see in a scar, and just depending on what we see, we can make changes to it.
Do you deal with a number of patients with cleft palate issues, children, younger adults? It's children in particular from an early age, a young age. Do you do a lot of work with cleft palates, or have you in the past?
So for children, children who are born with cleft palates and cleft lips, there are regional centres that will that'll look after these people, these kids, until they reach adulthood. And once they reach adulthood, then they will be they'll either be followed up or they'll be discharged at that point. And a lot of people born with cleft lip and palate, they're discharged at around adult life, because that's when they finish growing. So various things happen depending on whether you've got a cleft lip or a cleft palate, or a cleft lip and a palate. And so for someone born with a cleft lip, sometimes the lip will be repaired at about 6 weeks of age. Sometimes they have a cleft nose as well, so the nose will be addressed at that point. The palate is addressed at about 6 months, and that allows them to develop and speak and thrive, because sometimes it can have an impact on their ability to take milk. And then the next step is usually at around the time when when the kids have mixed dentition. So that's at about the age of 9 or 10, and the teeth are beginning to grow in a non-standard manner. So sometimes the orthodontists are involved. Sometimes the dentists are involved to remove teeth and to straighten teeth. And then as the child then develops into adolescence, then the nose can have an unusual appearance as well, but also the maxilla may not grow forwards as much as it should, and so they can get a bit of an underbite, and so they may need some maxillary advancement surgery, just so that their teeth meet properly. And then and in the final stages of adolescence, and as they grow, then we see the scarring from the lip work and the nose work, and so it's just a final tidy up procedure at that point. And usually at that point, it's all settled down.
Yeah, amazing. It's just there's a few comments about the cleft palate work that you do, and I think there's a lady there, speech therapist, talking about working with children with cleft lip and cleft palates. And do you get on well in terms of networking with other parts of the healthcare professions in looking after patients from surgery onwards, patients that need therapy, speech therapy, for example? Do you get on well in terms of networking with other groups of practitioners?
Well, because there's such a good network in the UK for NHS provision of cleft lip and palate services, because it's a super regionalised service with I don't know, maybe one or two surgeons for a 5 million population. Because what we know with cleft lip and palate is, and I'm going back 15 years to my training here, what we know is that the best results are performed or are achieved with surgeons who do this all the time. Yeah. So if someone is a child who comes to see me, then I wouldn't treat them. And also because of the regulatory framework that we have within again the UK for surgical provisions and the provision of services for children, the surgeons that are operating on children have to work in an NHS environment where they're involved with pediatric work in any case, and there needs to be a pediatric anaesthetist. Children aren't just small adults, or small adults, so they need provision for being looked after in a slightly different way. If they're going to be in hospital for a few days, then it's got to be done so that it doesn't disrupt their education. And if they are going to be in for a long time, then they need educational support while they're in hospital. So the people that I see who have been born with cleft lip and palate, they come to see me once they're in their 20s usually, and they say, you know, I've had my cleft lip and palate work. I've been discharged, but I still have some issues with my nose, with my lips, with my appearance, and I just thought I'll just get it done privately. So they still have the opportunity to get this done on the NHS, and the NHS I think provides a great service for children born with cleft lip and palate. But sometimes they, you know, once they're adults, once they're working, they've got a bit of spare money. They think, well, what am I going to spend my money on? And this is something that has affected them, and they think, well, I'll just bypass the NHS waiting list, because sadly they're becoming longer and longer. And you know, they're talking about 10 million people on the waiting list. They're talking about a 3-year wait for surgery if it's elective surgery, and it's you know, it's very sad that people have to wait, even though they have conditions that the NHS is very willing to treat.
Yeah. No, it's a shame, but I think there's a lot of great healthcare practitioners around the country doing a lot of good work in the NHS. So I think it's good that you're able to talk about that. In terms of somebody considering, say, surgical cosmetic treatment, what advice would you give to them, Taimur? Imagine somebody's watching this now and they're thinking, you know what, I think Taimur does a great job with breast augmentation and facial surgery. I think I need some surgery. What advice would you give them?
Well, I think you know, you've got to know why you want it. You know, what are you hoping to achieve? Because, you know, that's a question I'll ask. What are our aims? You know, and we also want to know, you know, are they fit for treatments? Are they otherwise generally fit and healthy? And from their perspective, they probably want to know, you know, who's going to do this, because I don't know anyone that's had this done, or I know someone who's had it done, but, you know, that's not the kind of work that I want done. So I would say to people, and I would do the same if I were in this situation, you know, find out about your doctor. Find out about your surgeon, find out about your practitioner, whoever's going to be doing whatever it is that you're going to get done. You know, have a look, find out a bit about them, and then don't consider a consultation to be a commitment. A consultation is just a consultation. You know, if you speak to someone and you find out a little bit, go away and think about it. You don't have to commit to anything. You don't have to have the operation if you don't feel comfortable about it. So that's what I would say. Do your research and make a considered judgment. And don't feel pressurized into having anything done. Yeah, think about it. I've had people come back to me 3 years after their consultation. Oh, I'm ready for it now. And I say, well, can you come in and let's have another chat before we book you in? But you know, some people have had come to see me several years after their initial consultation, and if it's taken them that length of time to rationalize their decisions, fine, good for them. You know, it's obviously something that they've thought about.
Yeah. Do you see patients that perhaps have had surgical treatment elsewhere and they've not been happy with it, so they've come to you for your view of what can be done for them?
Yeah, I think there's two types of people who come having had work done elsewhere. One is, I had my work done, you know, I was happy with the work that I did or that I had done, but just as time has gone by, things have changed. You know, our bodies change with time, our face changes with time, and maybe it's time for me to consider, you know, reversing that clock a little bit and going back to what I used to look like, or what I want to look like. So that's one thing. And then the other one is, you know, I had some work done and I really don't like the result. And, you know, what can you do about it? And that's that's the group of people you were asking about. And I would say that there's a timeline for these people, you know, because some people come and see me and they say, I had a bit of work done. I had an operation done. It was just a few weeks ago, and I really don't like the result. And some people say, I had something done, and there was a bit of a language barrier. I went somewhere, and I don't really think they understood what I wanted. And look how they've left me. And so it's a bit sad, because they were maybe pressurized into having something. I've seen some people who said, I went to Turkey to get my breast done, and they did my nose at the same time. And I don't like the results. So it's a bit of a shame when there's a bit of a language barrier. And but thankfully, most surgeons will look after their patients afterwards, because every surgeon wants their patient to have a good result. We don't do this deliberately wanting anyone to have anything but the best result we can possibly give them. Yeah. And so, sometimes if we don't understand what the person wants, or the person doesn't really understand that there's a bit of a recovery period before you're going to see your final results. These are the things that I think, sometimes I'll just have a chat with them about that, and to say, look, give it time. Let's see how things are going. Sometimes we can intervene, but the other thing is, if they still got a follow-up plan with their original surgeon, you can't have two chefs, cooking a meal. They got to decide, who's going to look after me. And if they decide, I'm going to carry on with my original surgeon, I'm going to carry on with my follow-up appointments, that's fine. But if they say, actually, I've lost faith in my surgeon, in the person that treated me, then what I need their notes. I need to know what was discussed at the consultation. So give me the consultation letter. Give me the consultation notes. I want to see what was discussed in terms of aims, in terms of risks. I want to know. I want to see their before pictures, and these are medically taken preoperative photographs. I want to then read the operation notes. And surgeons said, I've got terrible handwriting, but I can usually decipher the important parts of the operation notes. I want to see what's happened. And even if it's in a foreign language, medical terminology is often medical terminology, and I can usually find someone who speaks the language of the surgeon where it's been written. And I want to see what the guy did. So, because if the surgeon has done everything possible that I would have also done, then maybe there's nothing else that can be done, and this is as good as it gets. Then afterwards, I want to wait until we see the final results before we intervene. Because if you intervene too early, you're just going to be operating on scar tissue. So you're changing scar tissue, but scar tissue is going to change anyway. So there's no point in operating if you're just going to be operating on scar tissue. So if there is someone who's been a bit disappointed with the results, and they just want to transfer their care over from their treating surgeon to a different surgeon, then there's a process that you got to follow. And sometimes, if it's in the UK, the easiest thing to do is phone the hospital in which you had your surgery, and speak to the medical records department and say, I would like a copy of my medical records, please. And there will be a whole load of information sent. What kind of anesthesia did you have? Which antibiotics did you have during your anesthesia? I really don't. It's not of interest to me, but that information will come. But within that information, I will distill out the salient points of what happened, so that I can have an idea of, is there anything that we can do? And the thing is, that's also linked to my medico-legal practice, because a lawyer will sometimes ask me, could you comment on what's happened? Was it okay? Was it negligent? Was it the right thing to do, or was it not the right thing to do? And of course, I go through the same process. I sometimes help other practitioners, and I provide an outsourcing service for complaint handling. And again, that's what I'm doing. I go through the processes. Did the person have a consultation? How comprehensive was that consultation? Did they have an examination? And were the examination findings written down? Were the treatment options discussed? And was the treatment performed in a competent manner? And what was the follow-up and aftercare like? And what was the communication strategy between the treating clinician and the clinic and the patient? So I sometimes do this as well. So it's all linked, isn't it?
Yeah. Yeah, no, it's great to be able to listen to you talking about things like this. What about patients that perhaps are a complex case? Are you able to speak to other consultant plastic surgeons within a network and find out what their views would be of a certain patient problem?
Yeah, I think it's always good to work in a team. And the thing about private practice is that as soon as you go into private practice, you lose your colleagues. You go into working as a sole practitioner, and you're working on your own. So you got to find your network. You got to find your team. And you've got to find a multidisciplinary team. You know, when I was working in the NHS as a head and neck surgeon, the people in the multidisciplinary team, there were plastic surgeons, there were maxillofacial surgeons, there were ENT surgeons. There were speech therapists, there were dietitians, there were specialist nurses, there were radiologists, clinical oncologists, medical oncologists, and there were junior doctors. You know, and we had a research guy as well. So this was our team. I moved into private practice, and it was me, and that was it. So we had to. You got to build up your team, and I think your team needs to be made up of people from different specialties. So we have a doctor, we have a nurse, we have a pharmacist, or we have a non-surgical practitioner, we have a surgical practitioner. And within the surgical practitioners, you know, we have possibly a group of plastic surgeons, and we have people of different specialties as well. So, I'm in talks with one of my friends who's a general surgeon who's trained in breast surgery. You know, we have a maxillofacial surgeon who works with us. There's an ENT surgeon who says he wants to come along and do some facial plastic surgery. So I think if you can widen the diversity of your team, I think that makes for a good team.
Yeah, yeah. It's interesting. I was looking at your Instagram feed last week, Taimur, and you know Dr. Uche, who's actually a mentor of mine. He mentors my work.
Oh, right.
I've known him since last year, about 18 months back now, and he's known as the tear trough king for non-surgical tear trough treatment. And he's a really nice bloke. And I spoke to him after mentioning that I'd be talking to you this evening, and he said, "Small world. It's such a small world," because he worked with you. I think was that some years back now.
Yeah, do you know, the thing is, you build up really nice relationships with some of your colleagues, and it extends beyond what would be the normal professional relationship that we would have with people that we work together with. And I think with Uche, I think I found that because I think we had a lot of things to talk about. We had a lot of similarities. Yeah, I think the guy's a super smart guy. You know, he's one of the smartest people I've met. And so I really enjoyed talking to him about his life, about his vision, and about his plans to put his vision together. So I really did enjoy my conversations with him, and I still do.
Yeah, he's a really nice bloke, and he likes a good joke as well. Can have a joke with him without any problem at all. Thanks for all this so far, Tim. It's really great to be able to go through all these bits of information and advice that you've provided. In terms of the future, what are you looking forward to in terms of your work, or maybe research or writing? Is there anything that you're looking forward to in future?
I think I'm looking forward to my retirement. So I don't know how many years I got left in me, you know. So I've been at this for 15 years. You know, how many more years could I do? So I feel I'm middle aged now. So when do you give up? Do you give up when you're at your when you give up? Do you give up at your peak, or do you fall over that hill and start thinking, oh, my performance is deteriorating a little?
I'm sure you've not reached your peak yet. I'm sure you've got a long way to go before you go downhill in any way whatsoever.
So I think, what does the future hold? I think I'm maxed out. I can't work any harder. I can't work any more hours. I can't do any more than I do at the moment. And I'm in a very privileged position, and I realize the luck that I have with that. And I think, I think I do have plans, and it's difficult to put these plans into place when you're working, 9 to 5, Monday to Saturday. It's a bit difficult to put these plans in place. But what I would like to do is I would like to be able to pass on some of the information that I've learned over the years. And so, over the years, people have allowed me to take videos of their treatments. So I've got, and I've spoken during these treatments as well on a microphone, and it's recorded. So I've got a bank of videos, and really, what I would like is something like a Netflix channel where you can flick through your options. I want to learn about whatever procedure it is, and you can have that both targeted to patients, but also targeted to practitioners. So I think I'd like to put that together. So I just need my own Netflix channel. And but, I've looked into it. I don't think it's all that difficult to build a website like that.
You do it very easily, Tim. I think you get a lot of people interested in it as well. I think you'd be very popular.
And I could have special guest contributions. Would you be one of my first special guest contributor?
I'd contribute anything to you, Tim. Don't worry, whatever you want.
It's a deal. Let's do a virtual handshake on that.
We'll do that. I'll give you a handshake there. There you go.
There we go.
Thanks a lot for this. We've gone through almost 55 minutes of chatting here. It's gone quickly. I've got some questions for you at the end. I haven't mentioned any of these questions to you, and I do this with pretty much every practitioner I've spoken to in the lives I've done over the last year or so. So I've got some questions, and all you need to do, Taimur, if it's okay with you, is just answer a basic yes or no. No long-winded answers, no explanations. You just give me a yes or a no. So it's basically just quick fire. There's about 10 questions, and all I need is a simple yes or no answer from you. Is that okay?
Let's do this quick fire yes or no round.
You've got no idea what I'm going to ask you, so...
No idea.
Are you ready?
Go on.
Right. Have you ever sung karaoke?
Yes.
You'll have to put that on your YouTube channel. Do you use sunblock every day?
No.
Oh,
I'm the wrong colour for sunblock. I'm an Asian boy.
It depends how hot it is wherever you are. I suppose.
I live in Glasgow,
Glasgow's not that hot, is it, usually?
Well, we have no ozone in our atmosphere because it was all sprayed away by in the 1970s.
Yeah. Would you like to write a book? Can only be a yes or a no?
I know. I'm gonna say no, but I know. I've had people say to me, "You should write a book." I'm like, who wants to listen to me? It's like
you'd be shocked. There'd be people all over the world that would want to listen to what you've got to say.
I'm not sure if they would. I think I know a few people who have written a few books, and good for them. But
Uche has written a book, fantastic book about specialising as a healthcare practitioner. If he can do it, no reason why you can't.
I wrote a thesis. I wrote what was it, 25,000 words or something, and I've written stuff before. As part of my research into head and neck cancer, I think I've written about 30 or 40 papers or something like that. I've done a bit of writing in my time, but who wants to listen to me? Who wants to know what I've got to say?
You can think about it over the next year or two, and you might change your mind in future, possibly. Do you play a musical instrument?
I did.
You did?
So at university, I used to play the saxophone, and then the place that I was living in, it got broken into, and they stole my saxophone. So and then so I stopped playing after that, and then I moved into a flat. And I thought I can't really get a loud instrument, otherwise I'll just be that neighbour.
Oh dear, terrible. With a difficult decision, would you follow your brain over your heart?
Brain, yes, right. That's a yes.
You'd follow your brain. That's no problem.
So my considered judgments are more logical than emotional.
Yeah. Some people have to think quite hard about that because they're not quite sure which side they would fall on, the head or the heart. So I thought I'd ask you that anyway.
Yeah, and I think it's very difficult to repress emotional decisions that can be made without due consideration of the consequences and the implications. You know, one thing I've learned is running my business is to run various what if scenarios.
Yeah.
And you know, you make a business decision. What if the following things happen? What if the following things happen? And one thing that I never did, I never ran a what if scenario. What if the world goes into a pandemic? And I never ran that scenario. So now and during lockdown, I put together a force majeure policy.
Yeah.
And you know, what if we're invaded by aliens? What if there's a nuclear cloud that blows in the direction of the UK? What if there's a war? What if there's pestilence? What if there's famine? What if there's, you know, something of biblical proportion? You know, these are force majeures. These are things you just don't expect. What if there's massive flooding? You know, what if we get another ice age? I don't know. You know, so I actually wrote a force majeure policy.
You certainly plan things well, I must say. I've never come across anyone that's gone quite that far as you've mentioned.
I planned an alien invasion and the zombie apocalypse. I planned that as well. It's all in my policy. I'll send you my zombie policy one day.
I'm going to go to the next question before we carry on about zombies any further. Have you ever been and felt embarrassed during a consultation with a patient?
No, I don't think so. No.
Okay, no problem. Have you ever made a patient cry?
A what cry?
A patient. Have you ever made a patient cry?
They're usually tears of joy.
That's good enough.
Yeah. In fact, a lot of my patients, when they wake up, I would say about 20% of my patients, when they wake up, 1 in 5, when they wake up after their anesthetic, and they look at the results, they're tears of joy. Or if it's a rhinoplasty and they take their splint off after a week.
Yeah, amazing, amazing. Have you ever carried out work or advised a celebrity?
A celebrity? Now, what is a celebrity? You know, you got these people who think they're celebrities, but they're not really. You know?
I'm not defining celebrity, that's for you to do. But as I say, some people, there's lots of plastic surgeons that see lots of celebrities.
You know, I've seen some people, and then afterwards, people have said to me, "Oh, was that so and so?" And I'm like, "Yeah, how do you know?" And they said, "Oh, it's pretty famous." And I'm like, I don't know, I never heard of them. So there are people who are famous, and you know, I'm just totally blissfully unaware.
That's fine with me. Last question, Taimur. Have you ever fallen asleep during a meeting?
During a conference? Yes. And then what I did, so as soon as I woke up, I put my hand up and asked a question. No one knew.
And you managed to get away with it then without any problem?
Yeah, big time. Although my friends were saying to me afterwards, "You fell asleep and then you woke up and you asked a question." I said, "I wasn't asleep. I wasn't asleep. I certainly denied it. It wasn't me."
This is a sort of story you could include in a book without any problem at all. But I've got to thank you, Taimur. That's over an hour we've been chatting there. It's gone over an hour. So I've got to just say thanks a lot for your time and for entertaining me and all the viewers so well. So I hope perhaps in the future we might be able to do another live at some point and talk about another aspect of work or life in some way. But if you want to involve me in a YouTube channel, I honestly don't mind. I'm quite willing to do whatever takes your fancy. I'm quite happy with that. No problem at all.
Well, why don't we do this next time? Why don't we do a quick fire round of questions, and it can either be a yes or no, and you know, you ask me and then I ask you. I'll say, right, babe, yes or no, and then you can respond back to me, and then right, Taimur, on my turn, yes or no. So we could do that.
No, but I did it once, a 4-way live with 4 practitioners. Balsam was one of them, Uche was another, and there was another doctor from Rutland Aesthetics, Dr. Sunny Desi, and we did a 4-way. It would quite easily work doing the same sort of thing with more than 2 of us. If you fancied at some point, we could do that.
I'd never get a word in edgeways if Balsam was on. If she's on, Balsam, hello.
I tend to control the conversation quite well, so everyone's has got sufficient time to have a good talk anyway, so you should be all right. But no, I've just got to say thanks a lot. I think we're going to get kicked off any second now, so thank you very much for your hour-long chat with me, and hopefully we'll do something again in the future. Just say a big thank you, Taimur.
Thank you, Viv. Thank you for inviting me to join.
No problem. I'll catch up with you soon anyway, and enjoy yourself.
Cheers then. Bye-bye.
Okay, see ya. Bye.